Have you ever wondered why some health issues keep coming back? Suppression, palliation versus cure. What's the difference? Suppression refers to making symptoms vanish without correcting the underlying imbalance. As a result, they often return, intensify, or shift to deeper organs or systems, for example. Prolonged use of steroid creams for eczema, itching, etc. may later manifest as asthma, chronic sinusitis, or joints pain. Repeated courses of antibiotics for UTIs can eventually lead to their resistance, chronic bladder problems, or kidney weakness. Long-term use of strong antacids or acid blockers for acidity may result in impaired digestion and nutrient deficiencies such as depletion of vitamin B12, etc. Hormonal suppression of menses can later present as ovarian cysts, migraines, or mood disorders. Ignoring love or affection can lead to feelings of isolation or loneliness. Suppressing anger at work, etc., may cause increased stress, anxiety, tension, headaches, muscle tightness, or sudden emotional outbursts later. Palliation approach is focused on easing symptoms without changing the underlying disease process. It may enhance comfort and quality of life, but relief is temporary. Symptoms typically return once the supportive measures are stopped. For example, taking painkillers for headache or fever, etc., may reduce pain temporarily, but it doesn't resolve underlying triggers like dehydration, stress, hormonal imbalance, or digestive issues. Cough syrups, including traditional home remedies, may quiet the cough reflex, but they do not eliminate the infection, mucus buildup, or irritant causing it. Sleeping pills for insomnia, sedatives can induce sleep temporarily, yet they don't resolve factors like stress, circadian rhythm disruption, blood sugar instability, or hormonal imbalance. Inhalers for asthma or decongestant nasal sprays, they may shrink swollen nasal tissues and improve breathing short-term, but they don't treat allergies, genetic predisposition, viral infections, or environmental triggers, and overuse can worsen congestion. Key distinction: suppression means hiding disease expression or covering up symptoms without addressing the root cause, while palliation eases suffering without claiming cure. Your body doesn't create symptoms without reason. Pain, rashes, anxiety, fatigue, etc., are expressions. Suppressing them risks ignoring a vital warning. The question is, are we listening or silencing them? In modern life, we often suppress symptoms, physically and emotionally. Like painting over a crack in the wall, it might look better, but the problem's still there, growing deeper. When we only mask or suppress symptoms, further complications can develop. Research indicates that unresolved emotions or psychological challenges, such as anxiety, anger, frustration, fear, sadness, guilt, or emotional stress, may manifest as physical or mental health condition, including digestive issues, IBS, hypertension, migraine, sexual dysfunction, chronic fatigue syndrome, low immunity, autoimmune disease, emotional burnout such as depression, OCD and PTSD, etc. The pattern continues: palliate, suppress, repeat, while the underlying issue remains untouched. Palliation or symptom control can be helpful in emergencies, but that's where long-term trouble starts. Treating just the branch and not the root is why some people end up on more and more medications, dealing with side effects and further complications. Holistic healing asks a different question. Why is this happening? It looks at the whole picture: mind, body, lifestyle, and environment. When the body feels supported mentally as well as physically, symptoms often ease naturally. Remember, true healing isn't suppression but addressing root causes. Stop just managing symptoms. Start understanding your body's messages. Always consult qualified healthcare professionals for persistent issues. Your health journey deserves more than just quick fixes. Avoid self-medication. The wrong choice, even with herbs, can be dangerous. Always seek proper guidance. Thank you for watching. For further help or advice, etc., feel free to send us a text message. If you found this content useful, please like, comment, share, subscribe the channel, and follow for more natural and science-backed health tips.